Go.
So I have an order to do a wound packing on our patient here, Mr. Jones. So I'm going to enter my patient's room. Morning, Mr. Jones. I'm Susan, your nurse today. How are you doing? Good, I'm glad to hear it. How's your pain level right now on a scale of 0 to 10? 10 being the worst, 0 being none. So a 5. Do you want pain medicine before I go ahead and do your wound packing? Okay, let's give you some, let me go get your medication for you and make sure you're comfortable. So we'll give you the medicine and then we'll reevaluate your pain in about 45 minutes. Okay, 45 minutes has passed. How's your pain now, Mr. Jones? So 2 out of 10, wonderful. Alrighty, so let me grab my supplies and we'll get started. I have my 4x4s. I have cotton tip applicators that are in sterile packages. I have sterile gloves and I have a sterile ABD pad. This says combine pad, same idea. I have tape. I have a measuring tape to measure my wound, but my cotton tip applicators also have a measuring device on the edge. And I have my normal saline or sterile water. You want to make sure your date, time, and initials are on an opened container. And then I have my sterile container for my water. Before I get started, let me do my hand hygiene. And the other thing I want to make sure I've got set up here is I'm going to raise my bed to a good level for my working height so I'm comfortable and not bending over to take care of my patient. That's good. And then I'm going to actually put this rail down so that I can access everything. Next thing I want to do is make sure my table is set in such an area so that I am able to access my patient, but also not turn my back on my client. I'm going to put this to the side since it's not needed in my space. So, first thing I'm going to do is put on my clean gloves. And then I'm going to remove the old dressing. So I have an abdominal wound here. And I'm just going to remove my dressing, my outer dressing first. And then my packing. And then I'm going to note any drainage, discoloration on my packing, my dressings before I close them up. And then I'm going to just discard those in my garbage. So first thing I'm going to do is assess my wound. So I'm going to use my measuring tape and I've got 13.5 centimeters by 2.5 centimeters. And to measure my depth, I'm going to open up a package of my cotton tip applicators. And then I'm going to take one out. And very gently, I'm going to put it in the base of my wound, kind of find the top measurement of my stick, and then I can measure that against my package. So the wound itself is 2.5 centimeters deep. I will discard that. I don't need that. And then I'm done with that part. The color of my wound is red. I don't see any exudate or any black tissue called eschar. It looks like a nice healthy wound bed. No drainage, no odor. And then I'll remove my gloves. So be careful on how you take your gloves off so you're not contaminating your hands. Hand hygiene. And now I'm going to set up my, this is way too high for me. I want my table at waist height And actually, probably before I even get my supplies out, I would wipe my table off to make sure there's no dirt or anything on it. Okay, so I'm going to demonstrate setting up a sterile field using my exam gloves, like I talked about in my presentation. But the first thing I want to do is pour my sterile water, because if I have my sterile gloves on after I get my table set up and have not poured my water, then I cannot touch these, because the outside of these containers are clean, not sterile. So I'm going to take this cap off. I don't really need the cap. I don't want to touch anything on the inside of my container. Got normal saline, got date, time, and initials. These are good for 24 hours once they've been opened. This was just opened this morning. And then I'm going to fill up my container pretty full, because I want to be able to access that fluid pretty easily. And then I'm going to put this out of the way. Notice I put the water bucket here closer to my patient, not on this side, because I don't want to drip water across my sterile field, which will be here after I set it up. So, I open up my glove package, and I guess that's for a catheter. I have my garbage can to my left here. We'll see if that works out. So first thing I'm going to do is open up my sterile gloves. You have that flap there, like your video that you saw. I'm going to open this up. So the 1-inch border around this piece, this wrapper, is considered contaminated, the outer 1 inch. Anything within that 1-inch border is considered sterile. All right, so now the challenge becomes I need to be able to open my packages in such a way, get that out of my way. Actually, let's open up our tape. I'll get my tape ready. I need 4 pieces, 2 longer, 2 shorter, like that, because we'll use that to secure our dressing when we get done. And then to open up my packages, what really works well is to get the corners started. And then if I hold down the corner and then I peel back my package, that helps open and expose your gauze. Now my trick is I'm going to flip that onto there, but I'm going to fold back the edge so it doesn't hit the outer edge of the package, and then slide it on. So I'm going to open, let's see, 1, 2, 3, 4. Hold down your corners, peel back your package, flip your edge, slide on. Remember to keep your eyes on your sterile field at all times. Peel back my package. Ooh, I got a little corner there, didn't open that well. But bend it back, flip it on, and then I'll do one more. Hold down your bottom corners, peel back your package. Ooh, that one came back just right. Flip it on there. Alrighty, cotton tip applicators are a pain in the butt. I kind of loosen the package, but I'm gonna do the same thing again. And hold down the bottom corner. Peel this back. This one opens pretty well. Oh, maybe. They are kind of temperamental. And then I'm gonna flop these. Oh, look at that, I missed. So because this one fell outside of my sterile field, I'm just gonna remove it, take it off. Let's say that one's in my 1-inch border. And then I'm going to open my ABD pad, hold down my corners, pull back my edges, flip my edge, drop it on there. Okay, alrighty, so I've got my field set up, patient's wound is ready. So the first thing I'm going to do is put on my sterile gloves. So I have to get out from underneath my pile of gauze here. So I'm just gonna pick one up, and I'm touching the inside cuff. Oops, see, that just touched my hand, so I'm gonna take that off. So I have my handy assistant here, so I'm gonna put my gloves on first. So I'm going to pull my glove on, touching the inside of the glove with my left hand, and then I just pull it down around my wrist. This hand is sterile, so I'll move these over, and then I will get my fingers under the cuff, thumb out of the way, and introduce my hand into the glove, and then slide it on. Sterile gloves. So my only challenge is I need a cotton tip applicator. So my handy dandy assistant over here will come over and get me my other cotton tip applicator on the side here. Thank you. And open the package for me so that I can get that sterile cotton tip applicator. Thank you so much. Okay, so I have my gloves on. I have my sterile field. Now I can manipulate my gauze to get it where I want it to go. I will point out that these packages of 4x4s, there's 2 in each, so make sure you use both separately. So the first thing I'm going to do now is clean my wound. So I talked in my campus lab presentation, I am not going to clean the inside. If I was going to clean the inside of that wound, I would irrigate it, but we're not going to irrigate right now. So what I'm going to do is take my 4x4, take up my 4 corners, and dip it in my water. And remember, we don't want to get it on our sterile field because our sterile field is not a waterproof barrier. So now I'm going to clean, and I don't want my gloves to touch my patient. We're just coming down the outside, discarding it, and then I'm going to do it again with another 4x4. Wet. You can always come over here and just wring it out. Keep in mind, your hands need to be above your waist. And then I'm going to come down the other side. Discard. So now I'm going to take a dry 4x4. I have it bunched up so that my gloves don't come into contact with my patient's skin. And then one more time down the other side. So that is the cleansing process. So the next thing I'm going to do is take my 4x4, but this time I'm going to use this for my packing. So I'm going to open it up to a 4x8, and then I'm going to kind of fan fold it a little bit here. And then I'm going to fan fold it this way, back and forth, just to kind of get it all more compact. Get that in there. So how wet or how not wet or dry you want this to be, you want to make sure that it's going to maintain its moistness while it's packed in that wound. So this is where that fluffing comes in. Just so it allows the airflow in there, but it also provides that packing. So I'm just kind of fan folding it there, and then I'm going to use my cotton tip applicator. The other thing I will point out is I'm standing on the right side of the patient's bed because I am right-handed. So if I was on the left side of the bed, it would not be as comfortable for me. It would be kind of awkward to get this packing done. So this wound is pretty big. So we're gonna start, and we want the gauze just to go into the wound, not to hit the skin on the outside, like I'm doing. Kind of tricky. Because I can still see a lot of red from that wound bed, I do need another packing. Now, this one is contaminated, so I would have my handy dandy assistant get me another one. So we're gonna say yes, that she has done that, and we have put it on our sterile field. I guess I should have brought more. Once again, I'm gonna open this one up to a 4x8. I'm gonna kind of fan fold it, get it wet. It does kind of work to have the garbage can here and just kind of wring it out there. I want to fluff my gauze. Kind of fan fold it there. Get my new sterile cotton tip applicator, and then I'm going to continue packing. So you can see that I'm not really putting any like folded gauze or really hard packing. It's really kind of loose. So. And I'll tell you, when you're jabbing in the patient's wound bed like this, they're gonna feel it. So if you're looking at that close up on that video, you can see where it is wet. So I'm gonna take another 4x4 and I'm just going to wipe down. Discard, I would get another one and make sure all that water is off of there. Because if you cover up that skin that is moist and it doesn't have the ability to dry, then you get skin breakdown. I have one other 4x4, so I'm going to open this up and I'm going to place it over my wound. And then my ABD pad, when I pick this up, I want to keep the inside of the pad sterile. So I grab the outside where the blue stripe is, open it up, and place it over my patient. So at this point in time, I'm going to remove my gloves. So just to demonstrate how to take your gloves off. So you dirty to dirty. Don't do this with your glove, both gloves. So just grab your palm, remove it, and then come up the side of your hand and invert it, and then you can throw it away. I may do hand hygiene here, but first thing I'm going to do actually is put my tape on to secure my dressing. One there, one here. And down my edges. And then I will take another piece of tape and I'm going to put my date, my time, and my initials, and then I'll put it along the edge of my dressing to document when that was done. How you doing, Mr. Jones? You did really well with that. You've been a very good patient. All right, I'm going to leave my patient in a safe position, lower my bed back down. What is your pain now, Mr. Jones? About a 3? Yeah, I get it. Alrighty, and I'll clean up my work area. And then my final step would be to document. And we talked about the things that I would document. I would describe my wound, what kind of packing I did, what the how the patient tolerated the procedure, and what their pain level was before and after. That's it. Thank you so much.